Let's continue from there.
Well,
I'm giving you 5 minutes on this.
Yes, Siga. My main for this opportunity and my TA for near for matching. Now, as being a member of the College of Health Sciences, I think, sir, one of the most important developments under this government this year is the uncapping of the National Health Insurance Levy. OSHA, there's an Act 947, which is the Earmark Funds Capping and Realignment Act, introduced in 2017 by the most disingenuous finance minister of our time. OSHA Ziga. Sika nese ko National Health Insurance Authority honum no. Na afi de sika no yesi ye twemu ye de bi beko na ye de bi e de aye bibi foforo. At the verge of a collapsing health sector. Siga Ocean ye infrastructure our healthcare sector more na there was nothing to write home about. Na ya reho. Ye man no ko hospital ko wo a omo da fom omo no mo ba no da fom. Doctors our operation room omo ni we surgical gloves any nose mask kra for operative patients. Paracetamol kra patients be num no kra na aye ka our various hospitals ho. Inti saa de na Dr. Mahmoud Bawumia ni oforiata de baye no. Se omo nkape NHI levy no na enkoye ma ye healthcare system e Ghana. Nyame ya adum ya ba hu dawro as the members of the movement for change and other CSOs and health sector associations no obia ba hu dawro ama ene no omampanyi ati yasem and odi ayejuma intino that one I want to congratulate him. And I'm a person me done as a pa say what my yes sir. On the other hand, Ziga, me me and me papa was a victim of a chronic disease. Na e kodru memunu na say you don't know to dialysis mo. And ye ba. E dru memunu na dialysis kra no enye juma. Yeah. So we had to fly him all the way to India to have a surgery. Na surgery no no.
India.
Wow. Yes, all the way to India. Surgery no buy no. We no. Unfortunately no. Old man no. Ekoshia nananum. Na ziga. Asama amedo tu wenim no. This is a person sebi no could afford for all these treatments. Yenhwe Ghana enemu Ghana etemu no. Ahochire yekomu 8 years under the Eswa Mahmoud Bawumia ni Akufo-Addo regime no. Any senior omudi health sector edidi agro uka agenda 111.
Yeah.
Ekosi ene no kra na menye sure say watchman post no kra hospital back watchman post kra montimesi ewie. Ziga. And then non-communicable diseases amounts to 43% of deaths in our hospitals and our deaths in Ghana. Eya sempa. Now we have nkrofo omo suffer from chronic diseases no. Ziga. Yeah. 65% of families face financial challenges.
Yeah.
And they use 90% of their non-food income for treatment. Yeah. So this Ghana Medical Care Trust Fund no, is a special purpose vehicle to tackle this issue.
Yeah.
It's a good initiative.
Very, very good initiative.
But
very, very good.
Ziga, Ghana ha, adwin de yeka adwin senior yeka policies ye policies no de metemu say number 1. But through implementation Ziga, that is where the problem comes in. And that's why I like the fact that you are drawing Alote's attention to how best we should not politicize this good initiative and have a national approach so that Ghana for who say Ghana dear na enye NDC and MPP dear because yenim are partisan politics aye ye krom ewa hanum yenim say and you quite raise a legitimate concern say enkoye ne say edu baby a na say for party card bra na e dey show inti sebi no onye NDC ni a maybe no cry you will not enjoy the benefit of such funds. These are all legitimate concerns, and we know that it can happen in the Ghana that we live in today. Taking into consideration the kind of partisan politics we indulge in. Into the mini way are doing. And I mean him say allo te or tie. And I'm penny for bebre 8 years or so. We should not politicize this good initiative. Taking into consideration, say by 2036 or beyond, we want to achieve 100% universal healthcare coverage. I think that this initiative is also another vehicle that can help us translate these gains as we move forward as a country. And I know the Amebo President Mahamane and this for Abaya for this initiative.
They have done
and I hope that going forward, Ziga, there are more teething issues pertaining to our healthcare sector.
Yeah, it's true.
SMSC was Tamale Teaching Hospital. Obi Wuye, because there was no ventilator.
Yeah.
Siga, these are a lot of SMSC. As a year go round in circles, we should have a total review of our healthcare system and bring in policy reforms in place, and especially we should have a PPP model so that we can bring in private sector to help develop our healthcare industry, so that we can have policies to limit the amount of money our mubetima charge individuals. The US, Australia, private individuals are indulging in the healthcare sector of the nation.
Yes, in
a controlled manner.
That President Mahama said the corporate bodies, will be amran on beboa because on only the 6 months salary and the seed fund or their started is a very good initiative. But